everyone can have an opportunity to have some clarifications with regards to their presentation. So we'll have the next presentation from Dr. Bogs regarding similar efforts with using AI in cervical cancer. Doc, presentation please.
Thank you. Can I get the slides? Oh, I'm sorry. Okay, so thank you for the organizers for having me around. So my topic will be on seeing what we missed, leveraging AI to revolutionize cervical cancer detection in the Philippines. So as a disclaimer, I am a distributor of cervical cancer AI in the Philippines currently. So let's go focus on cervical cancer. We all know that cervical cancer is the second most common cancer in women after breast, and that it is preventable through vaccination and screening. However, despite that, 12 Filipino women die of cervical cancer daily. Now, of course, much of the causes is mainly our failure to cover vaccination. No? The WHO goal is 90%, first dose is 23%, second dose is 5%, whereas for screening, it's somewhat very low at less than 10%. So these are the problems, no? The lack of awareness, vaccine hesitancy, all of course, cost. And for screening, the lack of awareness, the lack of facilities, accessibility in rural communities, of course, the lack of doctors. We are, of course, also the nurses and the midwives, and patient compliance and the cost of screening. So it's funny, because we all have the approaches to cervical cancer screening currently in our country. We have HPV DNA typing, which is the best recommended form, but there is the high cost that prevents people from getting it. Pap smear has been here for quite some long, but again, the lack of infrastructures in rural communities, and we also have this VIA, visual inspection, using our naked eye. So I come to you here because we're now improving the visual inspection environment by putting out a colposcope. Instead of the naked eye, we now initiate a colposcope, which is there, or a camera, and today we now have this automated visual evaluation of digital images, which is simply artificial intelligence. Remember that remember that VIA is still our primary screening test as of 2021. So this is what we do. We go to GIDA, geographically isolated disadvantaged area. We ask a BHW or a midwife or a nurse to handle the colposcope. We capacitate them, and they conduct the VIA assisted with AI and using a colposcope. So practically, how do we implement it? We go to a rural community. We provide, not really provide, but we train them with the colposcope. So this is practically what we do. The normal VIA process. The colposcope is there for the camera, just to take a photo of the cervix alone. It's autofocus, so there's not much need of fine-tuning. Once several pictures are taken, it is uploaded into the server, and a temporary result comes out. It has once the images are taken, it goes to the artificial server, and then it goes to the doctor. The doctor has the final say how to read it. So this is a doctor right there. The upper left is the dashboard, logs in. Over there is the list of patients the doctor will read. This is her dashboard right here, and that once you select that, it becomes bigger. Then the doctor can annotate, make some changes, and then if you want to make it zoom, you can zoom it. You have even green filter. Then for the final diagnosis, they can just select either it's negative, low-grade dysplasia, and everything, and then send it. Immediately after sending it, it goes down to the clinic for the final result. So if the doctor by any chance cannot make the final evaluation, you can immediately refer it to the other doctors into Manila. Like for example, if you want to refer it to Manila, for either reassessment, if you want to refer it for either thermal ablation, conization, or for possibly biopsy, you can actually do that. And for treatment, you know. And then immediately once an evaluation is evaluation is done, the lady or the patient can immediately get the result the same day. So what are the benefits that we're trying to do? One, if using a colposcope, we can capacitate the barangay health workers kasi kulang na ang ating, midwives, kulang na ang, lalo na if you go down to the geographically disadvantaged areas, no? Of course, magnification, this is via over here, no? And that is a via plus a colposcope. So much clearer, so, accuracy is better, I suppose, no? For the AI, you have a reservoir of data, meaning to say, you can now compare yung previous image mo down to today, down to your future. And then, AI offers objectivity. No? Hindi lang kasi VIA is subjective. Eh. Of course, as far as accuracy is concerned, there's a study about this machine, and I don't want to go into details of that, but the conclusion mainly is sensitivity, specificity is improved, no? And it is a useful tool to assist diagnostic tool for proficient and inexperienced colposcopists in cervical cancer screening. No? For the doctors, we capacitate the local MHO, no? By actually connecting them with the future big hospitals, no? We call it cervical audits, no? So every 3 months, the colposcopist will read those evaluated by the MHO. And then later on, we inform them, we educate them. And then, of course, by getting the immediate results, there would be better compliance, and that we empower the patients to make an informed decision about their health. So this is the sample of the VIA results that the nurses or the midwife draws, whereas that's our report. No, it's the pictures are included, so they can actually send it to their OB. I'd like to take to call out people who would want to. We're actually providing free cervical cancer screening using this technology. Beginning tomorrow, we'll be in Marikina tomorrow. We plan to come up with 10,000 women screened in 1 year. If you have any organization that you would want us to come in, we can bring our colposcope assisted with AI for free. Just help us with the transportation and the food for my women, This is our schedule so far. I've canceled today because I was here. Tomorrow we'll be in Marikina. Pasay Moma on the 3rd. We'll be in Pampanga in 8th. Of course, Los Baños, Napolcom, Noveleta, Los Baños, Kawit, Lab for All in Nueva Vizcaya, Santo Tomas, Batangas, Pateros, and Silang. So I guess that's my last slide. Thank you for listening.
Thank you, Dr. Bob. I think your efforts for prevention and early detection is really good, as it is one of those that we like to emphasize, especially with the universal health care.